I trust you're all having a very lovely weekend. Hello, everyone. My name is Dr. Olukemi Olubade, and today we'll be having a career masterclass. You're welcome to this career masterclass brought to you by the Public Health Professionals and Students Hub. In this community, I mentor and coach early and mid-career public health professionals and students interested in advancing their careers in public health. I share free scholarships, webinars, seminars, trainings, grant funding, research and job opportunities, and also offer a personalized one-on-one coaching program. Again, my name is Dr. Olukemi Olubade, and today we'll be discussing about a career transformation opportunity open to Nigerian nationals called the National Health Fellows program. With me are two current fellows of the program, Mr. Daniel Alabi and Ms. Esther Aderibibe. Before we go on into the masterclass, we will introduce them and then they'll start with the Q&A. We're going to give a guide to help us understand what the National Health Fellows program is, how applicants can successfully position themselves to be selected, and then the tips to the application process and what to expect thereafter following the application. Our first speaker, Ms. Esther Oluwadunsin Aderibigbe, is a dedicated public health practitioner and National Health Fellow who is currently undergoing the fellowship program in Oyo State, Nigeria. She has a strong commitment to improving community well being, and she's currently enrolled in a master's degree program focused on reproductive and family health. In this program, she continues to deepen her expertise in sexual and reproductive health, health system strengthening, and evidence based public health practice. With a passion for advocacy, Esther works as a public health advocate and sexual reproductive health rights advocate, championing equitable access to quality health services and empowering vulnerable populations through education, outreach, community engagements. Her work reflects a strong belief in the power of informed communities to drive sustainable health outcomes. Beyond her academic and advocacy pursuits, Esther is committed to community development, contributing to initiatives that support primary healthcare utilization, youth empowerment, and reproductive health awareness. She is also a writer and uses her voice to shed light on public health issues, promote health literacy, and inspire positive behavioral change. Esther embodies professionalism, empathy, and leadership, and has a growing track record of impact in public health and community service. She continues to build her health career around improving health equity and advancing reproductive health in Nigeria and beyond. Ladies and gentlemen, please welcome with me Miss Esther Oluwadunsi Aderibigbe. Miss Esther, you're welcome. Would like to see you on stage. Our second speaker is Mr. Daniel Oluwatosin Afolabi. Daniel Afolabi is a dedicated medical laboratory scientist and National Health Fellow who is currently undergoing the Health Fellowship Program in Osun State, Nigeria. He has a strong academic and professional background in public health, medical microbiology, and parasitology. He's passionate about advancing diagnostic research and improving healthcare outcomes through evidence based laboratory practices. As an academic writer and health researcher, Daniel contributes to the promotion of quality healthcare services and delivery and public health innovation in Nigeria. Please welcome with me, everyone, Mr. Daniel Afolabi. So, a big welcome to our speakers. Thank you very much for joining this masterclass. You are very welcome. And thank you to everyone who is listening to this live stream. And for our viewers who will follow thereafter with the replay, you're welcome, you're welcome, you're welcome. So, Mr. Daniel and Miss Esther, at the moment, I cannot see both of you on stage. So I would like you to, you to put on your cameras so that we'll be able to see you. And Miss Esther, at the moment, I can with me. Mr. Daniel,
Yes, ma. Good afternoon. Good evening, ma.
good evening. So, how are you today?
I'm fine, ma. I'm glad to be here once again. Thanks
Okay,
for inviting the invitation.
okay, you're very welcome. All right, so let's get into the events and start with the questions. So, I would like to know, based on our conversation, can you please tell us about the National Fellows Program and how this program
Hello, ma. Hello. Can you hear me? Hello. Miss Esther, please. Can you confirm if hello, Miss Esther?
Hello, Mr. Daniel, are you still there?
Hello.
Yes. Can you hear me?
Hello, ma.
Yes. Mr. Daniel, please can you go ahead to answer the question? I said, can you please tell us about the National Health Fellows
All
Program?
right. I don't know if we can still hear me clearly. So once again, I'm
Please go
so
ahead.
glad to be here this evening. I'm so glad to be here this evening, and my name remains Afolabi Daniel Luatuse. As Mrs. Oluwafumilayo has rightly introduced, I'm a fellow representative for central local government here in Osun State. And about this fellowship, National Earth Fellowship Program, it's a program that is being initiated by the Federal Ministry of Health under the SWAP Coordinating Office in Abuja. And this initiative is to raise young people, young Nigerians to become a leader even in this health sector. And the motive behind this
Wow.
initiative is that they want to decentralize the medical sector. That is from the definition that WHO gave to health. It is not just the absence of disease or illness, but also want to know how physically, mentally, and even our social welfare is. And that is the reason why the minister, Professor Alipati, said, let's decentralize this initiative. That is, it is not going to be medical people, it is not going to be medical doctor, nurses, public health practitioners, and other health health people, but they want to include all some other professionals like from social science, engineering, Greek, and the likes. So this initiative, to me, I see it as an opportunity for young Nigerians to really showcase what they can really do to support and to make sure that the health sector is improved at the long run. Thank you so much, Ma.
Thank you very much for that response. So I'll still like to ask you,
Okay, Ma. Hello. I think the network is bad here. Can you hear me, Ma? Hello, Ma.
yes. So
Miss
both
Esther,
of you are
please, can
visible on
you
stage.
hear what? Yes,
Both of
Ma.
you are visible on stage now. So I was asking that how were you convinced that this fellowship was the right next step in your career in public health? What convinced you that this was
All
a
right.
good opportunity? Yes.
Thank you so much for that question. When I first came across this fellowship, what convinced me was that how it perfectly aligned with my impact, and what with the impact I want to make within the health sector. And I had been actively involved in community health work, and then I saw the gap that is inside the health system and even from the grassroots. Then the fellowship stood out because it wasn't just a training initiative. It offers a real chance for us to really work directly with the local government and other the Ministry of Health, and also it by applying the knowledge that we've been given that the knowledge that we've gathered over the years, and then showcase it at the local level. And then it also contributes meaningfully to the service delivery, because if you can see that nowadays the health sectors, the all we are trying to do is to improve our service delivery. And when I come across this program, this fellowship, although I didn't really take it so serious because I was one of those Nigerians that will say that, oh, this is not real. But what I always do is that whatsoever that I'm trying to do, I always give it okay my best. If it works out, okay. If it doesn't work out, because this is the first of its kind. In fact, I was even thinking maybe it's all these initiative that they will just give you money and then you leave. But for me, it served as a bridge between academic knowledge and a real life public health leadership, because we were trained to become a leader. We spent 2 weeks in Abuja, and we were trained to become a leader even in the health sector. And it was the right opportunity for me at that time, because it is just what I really need. It amplify my ability in the public health sector. I'm a kind of person that I love the drive of hepatitis, because it is silence. People do not really know about it, even though the work is ongoing. But I see this opportunity, excuse me, as an avenue to really showcase, having the backing of the government, to really showcase what I can really do, even in the public health sector. And this is just this how I was convinced that, oh, this fellowship is really for me, even though we didn't get it clearly when we started the application. Thank you, ma.
All right. Thank you so much for shedding light on that. So you've talked about the fact that the National Health Fellows program is coordinated by the Federal Ministry of Health through the SWAP Coordination Office. And
Excuse
your
me.
cohort is the first cohort of the program, and it's the opportunity came at the right time because you are very much interested in health awareness concerning hepatitis, and you found this a good opportunity to educate the public, and it has also inspired you towards health leadership in the public health space. So thank you very much for sharing that with us. So to Madam Esther, I would want to ask, what were the three strengths in your application that you believed helped you stand out among other highly qualified candidates? So if to what your application was like, what did you do that you felt made your application stand out? Or can you just quickly walk us through the application process? How was it for you, and what did you think you did differently that stood you out? Thank you.
Okay, good evening, Ma. Thank you for the opportunity, and I'm so excited to be here. Like I was rightly introduced, my name is Esther Ajobi, the
Madam
National Health
Esther, did
Fellow
you get the
representing.
question? Yes.
Yes, yes, I did. I got the question.
Okay.
Yeah. So I'm the National Fellow representing Kenya local government. Your question was the strengths in my application that helped me stand out. So I would say at first I really got to know the strength that helped me stand out. Not until when I got into the system, I got which is one of it is leadership skill. Because when I was in school, I held a quite a number of leadership position in school, my fellowship, during my service years. So they are looking for leadership skills. They are looking for impact in the community. Part of the things that were inside my curriculum vitae was the fact that, oh, I volunteered at a particular organization. They want to see you to the community. They want to see if you have interest in your community, community service. They want to see your health background, your field, if you have field works that you do, your volunteering skill, your leadership skill, and also the impact you have made in your community. Also, if you have a strong narrative of your purpose, like you are not using the generic curriculum vitae, you are being just true to yourself. Oh, this is what I am and this is what I stand for. So I think those are one of the things that stood out for me. Because during the course of my interview, the political interview, most of the questions they asked were real practical questions. Oh, you said you've served in this particular place before. What are the things you did? How did you speak with the stakeholders? What are the things you do first when you get to the community? It is when you've been on the field before you can actually say, oh, the first thing to do is to reach out to the stakeholders of the community, get their trust, tell them about what you have brought to them. And so they can easily talk to the community members concerning the programs you are bringing to them. And also the fact that you relate in what position or actually shows them the fact that, oh, you have the capacity to be a leader. And so one of the questions that I was asked when I was doing when I had the interview then was, how would you manage yourself when you are in the midst of two religion, because you're most of the leadership position I even put then was my fellowship position. So how do you manage being in a Muslim community and they will not see you as a threat to their faith and all of that? So building trust, actually telling them the real thing that you've been doing and being sincere to yourself, not having a generic CV, not having a generic curriculum of vitae, having a specific thing that you stand for. I think well those things that actually stood out in my curriculum vitae.
Okay, so if I get this right now, so aside the application, there was also an interview.
Yes,
Can
there
you?
was like two sections of interview. The first one was yes, yes, I can hear you.
Okay, so what I want to understand is that after the application, that is on the website, right? You made a submission, and it was
Yes,
thereafter that you were shortlisted for an interview.
yes, an online interview first.
Okay. And then after that online interview, then what happened thereafter?
Oh, yeah. So the online interview was just to like check if the real person, like if you are the real person that you say you are. Because the questions they asked us during the online interview was very few. They just want to see your face to check the documents that you dropped, because they are going to request for NIN, your pictures and all of that. That's, I think that's for confirmation. So after that, they shortlisted like three participants for each local government. So it was after that time then I had a physical interview where they picked just one person per local government out of the three that were shortlisted at first the- for the online interview.
Okay. So walking us through the interview, you're saying there's going to be the application where one would submit their information online, and then there was a short list of 3 persons per local government area across the country, and then there was now a physical
Yes,
interview where one person was now finally selected, and then that one
yes,
person
ma'am.
per local government was now represented across the country.
Yes. So we have 774 fellows in the country. That's
In
one
the
local
country.
government. Since we have 7 local government area. Yeah.
Okay, okay. All right. So thank you for walking us through the application process. So to Mr. Daniel, I would like to ask, based on what Miss Esther has, highlighted that in the application process, one has to show their impact. So how do applicants work around that? Many applicants struggle with showcasing impacts. So for you in particular, how did you communicate your contributions and achievements effectively?
All right, man. Thank you so much for that question. For me, what I did is that I first demonstrated a clear community engagement. What are the things, what are the activities that I'm already doing? That
Okay.
is to let them know that even before now, I've been contributing to the public health system. So, and I don't just say that I was passionate about anything, I showed evidence of those works, maybe via attaching my LinkedIn profile to my CV, and also to mentioning the name of those organizations to the extent of going to the town that we've had several outreaches. And secondly, I had a proven solving mindset. That is, if I'm coming as a National Health Fellow, what problem am I going to solve? Instead of listing all these tags, and I explain why I did them, and then what are the change I've seen as a result. So those are the things I put together. And thirdly, I presented that I have a well-defined career vision. That is, it is not all about this application. It is what I'm really interested in. It is my vision. And then if we look around, you will see that the health system, especially for those people in the local, the grassroots, it is not what it should. So all these things coupled together really give me the chance to really showcase, okay, this is my strength, this is what I can really do, and then how this fellowship could strengthen me more in this journey, in my journey in public health. So those are the things I put together, and I ensure that it is well harmonized so as to submit a very good and outstanding application.
Okay. Thank you very much, Mr. Daniel, for that response. So, if I get what you said clearly, you are highlighting the fact that there's a personal statement, right? And in that personal statement, it is important to showcase your impact by
Yeah.
using, evidence that is verifiable,
Yeah.
the work that you did, the organizations you did them with, and then the measurable impact that was achieved,
Impact.
right?
Yes.
Okay,
Yes, ma'am.
so thank you very much for that. So back to you, Miss Esther. I would like to ask, can you share common mistakes that many applicants make and how prospective fellows can avoid it? Because now we've talked about so far what the National Health Fellowship is, the application process, how the selection is done, how to put together an outstanding personal statement, essentially, having and being able to communicate that impact in terms of where and and how the impact was achieved. So how can prospective fellows avoid common mistakes and how can they position themselves better to be successful applicants? Thank you, Ms. Esther.
Okay, yeah. Thank you so much, Ma, for the question. So, well, I don't think I can even cover mistakes. Like, there are a whole lot of mistakes that can be made. At least I would point the essential ones, basically. Because some could actually make it up and they have one or two issues based on the things into consideration. So because we all believe that we should have a very beautiful curriculum vitae, a very generic one that people would see and love, packed up with activities and all of that. So the first mistake people make is that having a generic CV, which is, I would tell you that is quite different for this program, actually, for this NHF program, because you'll be assessed based on your curriculum vitae. They see the CV as, oh, who you are. So if you put the things that you're actually not doing, but you just put it based on the fact that, oh, you want to be there, there's no way they are not going to fish you out. Because in the interview room, they will check, oh, I've been this place before. What were your impact there? What would you do there? So imagine somebody saying, oh, I volunteered when I was at this particular place, at this particular, it's possible to even volunteer. But the fact that you are not able to defend that thing that you put into TV is it's a major mistake. If you know that you cannot defend what is inside your curriculum vitae, don't bother to put it at all because you are going to be assessed based on what is inside your CV. So I would say that's one of the mistakes, and also the mistake of state of origin. Those are some mistakes. State of because there is a clear instruction. Make sure that since the program is even grassroots based, like you giving back to the society, strengthening the health system right from the local government level. So they want to see you put back to your local government. So if you are from this particular local government and you stay in a place that is far from there, I tell you that you might need to relocate back to your local government to make impact. If you are not going to do that, don't even bother putting in for the application at all. Because they would see that, oh, you say you're staying at Akinyele local government, but you're living at Oshun, but your local government is carrying Oyo. They know that, oh, the work is not effective. Only if you like promise that you are going to, and they would actually want you to be based at your local government area. So if your local government is different from where you are living, is one of those things they fish out as well. So the application might not be successful. And also the use of artificial intelligence in answering the questions that is being asked during the course of the application. So is AI, is it bad? No, it's actually very good if you make use of it intelligently. Like make use of the AI. Don't let AI make use of it. Make use of you rather. You prompting the AI that, oh, I, because I think one of the questions they asked back then, what are the impacts you've made? So it's possible you just point your chat GPT and tell them that, oh, tell the chat rather that, oh, help me to write the impact I've made. And you've not made any impact. Of course, the chat is going to give you a generic answer. One that to anyone. But based on the fact that you have to defend that thing, election was really a rigorous one. You must be true to yourself. You must be true to your, no matter how when you get to the place, you must be able to like defend that thing that you put inside your CV and the application as well. So if you are telling them that this is the thing that you might not be able to defend it, so it's a mistake that you are making. How you can actually go about that is, what have you done? What you've done, actually you can prompt the chat based on what you've done. So, I've been to this particular community, this was what I did, and the chat can actually help you to enhance your writings, and that would win you like a win for your application actually. But the thing is, when you get there and you are able to defend that which you've done, it will actually save you a lot of stress. And other mistakes that I can still say is, the thing is, to cap it off, I would say be true to yourself. I mean, you can't lie on your CV, you can't lie on your application, and physically, when you get there, you can't defend yourself. There's no way it's going to work. It's not going to work. You just have to be true to yourself. So, know the part, that, be true to yourself. Whatever you do, whoever you have, no matter your qualification and all of that, what they, that you, the impact you've made, no addition, no subtraction. So
Wow, thank you so much, Miss Esther, for
that
that very detailed
is all I'll
response
say.
on. Yes, thank you very much for that detailed response on the different errors that an applicant can make and how to prevent such errors. Thank you. So, Mr. Daniel, I want you to add maybe one or two more points before we go to the next main question. From your experience and from the experiences of the other colleagues that you have interacted with, what are the common mistakes that could affect one's application?
All right, Ma. As rightly said by Miss Esther, one of the mistake that applicants do make is writing a generic, using a generic work. For example, you are writing that the reason why you are applying is because you want to improve the health in Nigeria. How do you want to do that? Be specific enough, and then to really tell those people that are reviewing your application that you really know what and how you want to really do this, improving the health system. Then another thing is that you should you should design your CV in a such a way that if a layman, the person that is not even an health or in your field, see this CV, you will definitely know, okay, this person, this is who you are. Because the mistake people do make is that they want to put in for they want to apply for a particular thing, in this case, NHF now. They don't really have that CV, but they will just cook one in the middle of the way and then try to just make sure that they submit an application. But having not knowing that this your CV is the only thing that will speak for you why you are not there. So submitting a very good and professional CV is one of the important things that we applicants should keep in mind, because one, your CV should be in order, then you should, while arranging your CV, it should be the most recent work that you are currently doing, that should be the first thing the reviewer will see. Ah, okay, this is what this person is doing currently, not you are maybe you served last year and you are now putting it is in disarray. So that shouldn't happen. And then I always tell people that you should prepare yourself for opportunity. Don't look for opportunity, but prepare yourself for opportunity. If you prepare yourself well for that opportunity, even when it comes, you will into that opportunity. So that's just for my end. And then another thing I would love to add is that when you are writing your story, let it be authentic. Let it be authentic. Don't just cook up a story, because when you are on the physical interview, they will want to test what you put inside your CV and see how you will answer that. And if it's not aligned, you're already shooting yourself in the leg.
Okay, so thank you very much, Mr. Daniel, for those additions. So let us quickly attend to some of the questions that are dropping in the comment section. So someone asked about where they can register, and they want to know if somebody who studied environmental health can apply. So, Miss, can you quickly answer that question? Hello.
Hello, please, can you hear me?
Yes,
Yeah, I
loud
can
and
hear you
clear.
now.
Hello, can you hear me?
Yes, we
Okay, okay,
can hear
thank you.
you.
So the good thing is that okay, okay, thank you. I said the good thing is that health actually spans beyond the the just health sector, the hospital. So I want to address the question. You can apply on just go to National Health Fellows. You're going to see the website to apply. And so for environmental and health science, you can apply because you are related to health. So I'm also saying that the good thing is that it spans beyond health. You know, talk of anything. The most exciting part of it is that I would say anybody that at least have a BSc degree, HND degree, you can apply. I mean, during our time, I don't know if there's any restriction now, but it's health and social science with information and communication technology. So if you have background in health, if you have background, in fact, we had then someone that studied pole science, and it was actually because his CV was nice, it was something they wanted. Someone that shows, like I said, someone that has shown leadership position, skills, someone that has passion for community development, and many more that once they can see your passion, see that you want to do the community is a win for you. So the health background, information technology background, any background that you think they can actually apply, just give it a shot and then you are there.
Okay. So, Mr. Daniel, what's the age limit for the application? Somebody has asked about age limits.
The age limit for this application, if I'm right, is 18 years to 25 years to 35 years. Am I correct,
Okay.
Miss Esther?
Say that the good thing is that it's fun.
Yes, I believe so. It's stated on the website as well. So, if you're just joining us for this masterclass, it's a career masterclass talking and discussing about the National Health Fellows Program. The National Health Fellows Program is coordinated by the Office of the Federal Minister of Health and Social Welfare, and supervised by the Swap Coordination Office. And this National Health Fellowship is such that it is to bridge the gap in the healthcare system at the community health level. And so, persons who are interested should go to the website, nationalhealthfellows.ng.gov, if I'm correct. The website is somewhere in the comment section, and you can make your application with a very strong personal statement and CV, as our fellows have highlighted and commented. And for those who are applying, we wish them the best in the application. So, the next set of questions I have for our fellows are that for Mr. Daniel, I would like to ask, how has this fellowship shifted or strengthened your career trajectory within the Nigerian and global public health space, especially in the context of your area of interest? I would like to know.
All right, Ma. Thank you so much once again. This fellowship has really shaped my direction both locally and globally. Working with the local government health authority, that's the LGHA of my local government, and it exposed me to several things like health systems strengthening. Because one of the challenges that I really faced in this fellowship is that when I go to my local government, I see a lot of gaps, a lot of things that it has to be strengthening. And then also in the disease surveillance, which is still aligned with my own career, because for example now I was able to do a kind of research on what is really the prevalence of hepatitis in Osun State, in Nigeria, and then globally. So coupling these things together, I was able to see that okay, this fellowship it's worth doing. And another thing is stakeholders coordination. This fellowship has already helped my leadership role in engaging with leadership, even at the local level, at the state level, because there are a lot of activities that, as a fellow, you will have to be there, meeting dignitaries, commissioners, some people in the Ministry of Health, even the traditional rulers. So it really helped me in having a kind of a skill in how to coordinate stakeholders to ensure that we really achieve our target, our purpose. And then another thing is policy implementation. One of the interesting things that I really enjoy in this fellowship is hello, ma.
Yes.
Okay, I'm
Welcome
so
back,
sorry.
Mr. Daniel. No, it's
I
okay.
think
So
the
the
network,
network. Yes,
yes.
please continue.
So I said one of the interesting things I really enjoyed during this fellowship is the policy implementation, and then during the AOP, the annual operational plan of the state, the sub coordinating office really engaged the fellows in trying to help the local government team to harmonize all the wards within their local government, all their plans, their activities, to ensure that we really have a data-driven decision making process to prepare ahead for the next year budget. So, and this thing really helps me that okay, this is how this is being done, even though it's an a new a new niche. I don't know much about policy implementation and the likes, but this fellowship has really enhanced my ability to really move with stakeholders, other colleagues, to ensure that our policy implementation is really data driven. And then these are the things that I really enjoy and how it has shifted my career trajectory. Thank you, ma'am.
Okay, that's awesome. Thank you so much, Mr. Daniel. So the website for the application is healthfellows.ng/apply. Healthfellows.ng/apply. And there is going to be a recording of the masterclass in LinkedIn and also on our YouTube channel. So you can always go back to this recording, this replay to review all the information that has been shared so that it will guide prospective applicants. All right. So thank you very much, Mr. Daniel and Ms. Esther, for all your responses so far. I truly appreciate you for your time and for all the important guidance that you have shared to prospective applicants. And because I believe that this masterclass will be an eternal resource for as long as the fellowship, exists. People will be able to access this to guide them on in how to, apply and how to position themselves as preferred candidates. Thank you to our guests. So, to Ms. Esther, I would like to ask, what leadership or technical skills have you gained that you believe are very essential for public health professionals today? What have you gained in the context of leadership from the National Health Fellows program? And what technical skills have you gained that you believe are very essential for public health professionals today? Apologies for the network glitches. We are trying to sort this out so that we can give you a very good experience of this conversation.
Hello, ma. Can you hear me?
Yes, loud and clear. So we're back. Apologies for the network glitch.
Hello, ma.
So, yes, I can hear you loud and clear, Mr. Daniel. I believe you were able to get the question before we had the network glitch.
Yes, I think I was it the one that you asked about this. We were able to get during the course of our.
Yeah, so I said, what leadership of technical skills have you gained from the fellowship that you believe are essential for public health?
Oh, okay, okay. So, leadership, of course, leadership is very essential for public health. The fact that there's collaboration with stakeholders and community members is a very big skill, at least, if I would say. So, leadership skill, collaboration, collaborative skills, yeah, the communicative like skills, communication skill across the community, across the peer, across the government, because sometimes we have meetings with commissioners. So there's yeah, the confidence skills to a level. The the technical skills, monitoring skills. Of course, we would whatever it is we have this monitoring and evaluation skills. I would give my a community, mainly community. Of course, we are not just talking about the 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 if we are not there functioning, the impact that is this still ongoing? Something the community has owned themselves and they see the reason why they need to continue it. And this can only be done and be checked through monitoring and evaluation. So the monitoring and evaluation skill, the community engagement approach, of course, we were invited or taught on how approach community stakeholders, civic leaders, which I would say wasn't um that really, in wasn't a community engagement approach. The health system thinking, yes, the health system thinking, we cannot overemphasize that. We had conferences where we need to sit down to think to, oh, how do we go about it? We discover solutions to problems. We have a lot of problems highlighted together. We use a lot of method, the fishbone method, the data analysis skills. For some, I would say I'm still improving myself on that. But for those that are really in into the data analysis, it's an avenue for them to get more inclined in data analysis skills and evidence driven decision making skill. I mean, it's not just about, oh, this is what we discovered in this community, or this is what the problem is, let's provide solution to it. No, we work based on evidence. Oh, like we had the MAMI program recently, that's the maternal and neonatal new reduction of maternal and neonatal initiative that we had then. We went to a particular where they had the we went we asked why, what made this person die, what has done better. We work based on evidence, decision based on evidence. Together for the mommy um problem finding. We later we put decision making skills and program implementation basically. And I would say report writing for those that because you write a lot of reports, report writing, proposal writing, you a lot of reports and documentation basically because you need to document for every visit that you every place you get to visit, you need to document and how and the that I was able to learn during my time.
Okay, so there was a bit of lag with your responses. So I think I'll quickly go over what I was able to gather. So, and you could still help us in the comment section, in the course of the live or thereafter. So you said that part of the leadership qualities that are essential for public health and that you have gained in the National Health Fellows program are report writing, documentation, communication, leadership, project implementation, proposal writing, and project development. So essentially, these are very important public health competencies, and it's great to note that from the health fellowship. Okay, so I think we're all back now. We apologize to our audience for the persistent network glitches. Um, we're rounding up now, and I just want to quickly get a clarification on something that Miss Esther had mentioned, and that was about in their local government of origin. Probably the person resides in Lagos State, but is from, let's say, Kogi State or another state, resides in Lagos, but from Ogun State. Okay, let's use that example. States are close. So, are you saying that the fellow would now have to relocate to Ogun State to be able to participate in the fellowship? And is there going to be any kind of relocation allowance? How does it work?
Okay.
Either of you can
So,
kindly
okay,
respond to this.
can you hear me, please?
Yes, loud and clear.
So, I mentioned the fact
Hello, ma.
your local government should be preferably your um where you reside. That's because they want effectiveness with work. So, like, and I made an example of the fact that I'm from Akinyele local government, or and I stay at, let's say, Lagos. So preferably for the period of that year, it's advisable to change from where you are staying to your government, because it's to be that if you are from Akinyele, you be staying in Akinyele local government, they will know that you know the surrounding environment. Like, there's no way I will, I know the PHCs in my community. I know where to step. I know the way it is. I know what my community is lacking. Yeah, majorly, it's about strengthening the health system from the grassroots level. So if you want to strengthen the health system, you must be strengthening the health system based on your community. But because I stay in this community, I know what they are facing. I know the gaps. So I'm trying to find solution to the problem that the community is facing based on the avenue the government have given me. So it's not really effective if your local government is different from your present residence. So that's why it is advisable. And I think that those are the things they check while they are shortlisting people, because they know that it's not possible for you to say, oh, you have a local government, you have a fellowship at Kwara State, and then you are staying at Osun State. It's disjointed. You might not be true to it. You might not be going there. So those are one of the things they will check if they want to shortlist someone. That they will check, oh, your local government is different from your state of residence. So it's a no. Like, even if you have everything they need, they know that it might not actually work. So that's why it's advisable that you stay where you really want to give back to your community, you can stay there. And I will tell you that it's something that it's well, let me just it's a program actually. You can still, at least during the weekend, go to other places that you need to be, and just make sure that your assigned role, whatever it is you want to do, you are doing it there. But they would not say, oh, you should not go to where you want to go to.
All right. Thank you very much for that very important information and clarification. Okay. So in what practical ways can fellows use this program as a stepping stone?
Hello.
Mr. Daniel, I'd like to hear from you. In what ways can this fellowship act as a stepping stone into international roles or postgraduate opportunities? I'm not sure Mr. Daniel is here. So, Miss Esther, please, can you assist us with that question? Can you assist us with the
Okay.
answer to the question? How can this fellowship
Okay.
position one for global opportunities? Because this is also one of the things that we do in the public. Madam Esther, did you get my question?
Yes, I got your question, ma.
Okay, please go ahead with the answer.
Okay. I think the question is what experience, or please can you.
So the question is that how does this fellowship position one for international opportunities or postgraduate education? Because like in the public health professionals, for part of our mission is to connect early and mid-career public health professionals to global opportunities. So we want to know in what practical ways can fellows use this program as a stepping stone into international roles or postgraduate opportunities.
Okay. The experience with the real world health, um, field works, field experience that make you uh, the strong evidence of how the health sector, then the connection working at the same time, because it's a fast beyond local. Even though we are working from the grassroots, but beyond the local government, make decisions down to make decisions state level and at the national level as well. So there's a way that when you network with people, access to international partnership, international it depends on how you can
Madam
go.
Esther, please can you
And
change your location a bit? Can you move because like the there's
okay,
a lot of background sound. Yes, maybe that can help the
how
network
about
to spread better. Okay, it's a better.
okay, yeah. As far that
Yes.
in okay, as far as the networking aspect of it can actually give you access to international bodies. Because even though it's a local government uh, program, I mean, it's from grassroots, strengthening the health system from the grassroots. But I tell you that decisions, conferences are made from the local government level, state level, and from the national level, I mean, the federal level, that give one access to international partners. I mean, there was this program they just completed, and the state coordinator was telling us that the international agencies are actually interested in some of our capstone projects because to cap off the fellowship, we are going to have a capstone project that is going to like show the proof of our capacity for the things we've been learning, the researches we've been making, data we've been collating together. So we have to have a capstone project that is going to like show that we actually we know what we are doing, going to help us to build our capacity. And so the international told us that program we just completed at Calabar yesterday that is interested in some of the fellows capstone projects. So is very very like is an opportunity one can leverage. I mean the reports, the field experience, that are strong experience for postgraduate applications because you already have field experience, so you can tell them that this was what I did when I was in the. I mean the evidence based decision, the data collection, the experience with the real world health system the beyond public health beyond the public health, the field work experience that can qualify one point. development role. And also the on, like I mentioned, our capstone project as of your capacity for implementation, research, and program leadership, basically.
That's great to hear. So, essentially, the fellowship builds one's capacity, improves your competences, and helps you with a lot of globally marketable skills, such that these skills can help you, you can leverage on them to apply for other international opportunities or postgraduate education. So, thank you very much for that information. So I would like to ask Mr. Daniel, if you could advise your pre-fellowship self, what would you do differently in terms of preparation or mindset? How would you, based on what you have gathered and you know now, and what you knew before the application, what would you have done differently?
All right, ma. Thank you so much, ma. If I could go back there, I would tell myself just a couple of things, which is one, document everything. Because
Mm,
in the application, I got to understand the importance of you documenting things, my report activities, the result of those things that you've done will become an evidence for the future. Don't just, maybe probably you are engaged in an organization, you do outreaches, even if it is touch, we should learn to document. So if there will be anything I will tell myself is that always document it down, and then because you don't know when and how these particular activities that you've done, the result and the reports can really help you in really showing that you have a evidence base uh what's it called, activities, and then in the nearest future opportunities. And another thing I will say is that network boldly. One of the things I've learned is that networking really helps to amplify one in a particular.
Daniel, are you there?
Hello, ma.
Okay, Mr. Daniel, are you back now?
Okay, Mr. Daniel, are you back now?
Hello, Madam Esther.
Hello, Madam Esther. Yes,
Can
ma'am.
you please help us continue with the response to that question about what you would do differently if you were doing your application all over again? Yes, can you please continue with the response?
All right, ma. I'm so sorry. I don't know what happened to this network. So what I was saying is that another thing I would have also loved to do then is that embrace challenges. Embrace challenges. Then I see a lot of up and down that people were saying it's not going to work out. It's not going to. It's not real. But I just say, okay, there is no harm in trying. So I will always have tell myself that okay, we should always try to embrace challenges. Just gather whatsoever that as little as the skill you have, just embrace just that challenges, face it, and then we'll see what outcome we can bring out from that. So those are the things I would have loved to improve on if I could have the opportunity to go back and then see how I will have done things better. Thank you.
Okay, please can you go over the response again? Because for most parts of your response, we could hardly hear you. I would appreciate if you could
Okay.
go over the answer again. You were talking about can you quickly can you
All
quickly
right, ma.
summarize
All right.
that so that our listeners will be able to
Yes.
appreciate better the essence of documenting? Because like in the public health professionals hub, there's a framework we also use to educate our mentees about how to succeed in public health. We talk about education, experience, exposure, evidence, that is documenting one's journey, your different activities, your wins, and then expertise. So can you quickly run us through this issue of evidence, documenting
All right.
one's journey, and the
All
other
right,
things
ma.
that you would have done differently with benefit of hindsight?
All right, ma. All right. As I said earlier, that documenting is one of the key things that I will have done better during my application. And then documenting your report activities and even the result of whatsoever activities you've done. It's very, very important because that will only serve as evidence that, okay, this thing has been done. There is this saying that anything that is not documented is not done. So we should have this mindset at least that okay, if as little as a church outreach can be, you partake in that activities, and then this is your role there. Don't just generalize it that I conducted, or we do this or we do that. Just state your role in that particular thing that you've done, and then document it. And then another way of documenting is that make yourself visible online. Like for example, make use of your social media. Thank God for the kind of storage we have now. Whatsoever that is there, as far as I'm still concerned now, it's there forever if nothing tampers with it. So you can quickly go back. Oh, I did this particular thing in 2022. Okay, let me see what and what I can bring out from this. And then before you know it, you will have some evidence that okay, I'm really in the system, because what your viewer, what your interviewer, what whosoever is reviewing your application want to see is evidence-based what's it called, applications. They want to see that this that you are doing, are you really getting it right? And then is it what you are doing currently? How genuine are you? And then one other thing I will say is that network boldly. Let us harness the opportunity that we have on the social media to network with people that can really shape on our life. Mentorship is very, very important because it will help you a lot. And then another thing is embrace challenges early. For example, now this application is has been on since November 1. Some applicants are still finding it difficult to apply. Embrace challenge because maybe due to that, I am not qualified for this and I don't have the experience. The little you have, package it well and then embrace that challenge as early as possible, because as you are trying to apply, thousands of people are also trying to apply. And this I would digress a little bit, looking at the aspect of your local government and the likes. I always tell people that it is better for you to stay in a good ground. We might have some fellows that okay, they chose this particular local government, but they are not in that local government, but still within the same state, and it was they were selected. But to be on a better ground, it is advisable that you apply early. That is one. And then you let where you are correlate with what local government of origin you are submitting. So those two things are it's very key. Let us document everything that we are doing, network boldly, and also embrace challenges early. So those are the three aspects I would have loved to work more or do better when I was applying, because I apply at the deadline. In fact, it's almost, maybe it remains like 5 days to the deadline, and I just put in the application, then hope for the best. But what I think helped me through is because my essays, and then it's very, very convincing. They are real thing. They are real thing. And when I always write essay, I do like to attach some evidence-based raw facts, because I know these people can really access the internet, check this guy, okay, what's he doing, what's he doing, and then they will say, okay, this person is genuine and not like he's lying. And I think Dr. Ashiru made mention of something when he was on a particular meeting. I don't know if it's webinar like this. He was saying that most of applicants that were rejected, the application that were rejected is because they later discovered that those applicants lied about what they put down in either their CV or the essay they wrote. So those are the
Wow.
things I would have said, okay, let's improve on, and also do better in documentation is very, very key. It's very, very key. Thank you so much, ma'am.
Thank you so much, Mr. Daniel. Thank you so much, Madam Esther. Even with the challenges of the network and the glitches, we've still had a very successful conversation. And to our audience, those watching us live and those on the replay, I hope a lot of the information that our speakers have given us will be very helpful in the application for the National Health Fellows. And I would want to appreciate everyone for staying with us and coming this far with the masterclass. And so I want to reiterate the fact that the application is open to all Nigerians between the ages of 25 to 35, and focused on health related degrees, studies, and also social sciences and information and communication technology slash areas related to things like data science. And so, as part of the application, it's very important to put together a very convincing, well structured, and truthful personal statements or essays, and then to have a very well put together, well structured So it's important to have a well structured CV, and also important to fill all the required fields truthfully and accurately. Some of the important information our fellows have given us is that it's important to embrace challenges, because a lot of the tasks and activities one would do as a national health fellow, it requires you to be very, very resilient, and you must give your best to whatever responsibilities that you are assigned. And then it's also important to note that your skills on the field will be tested, So whatever it is you do with regards to community health, advocacy, and supporting your community, you must find a way to bring it out very strongly. And then they've also talked about what they have gained from the fellowship in the context of leadership, documenting, communication, projects implementation, implementation research, and so many other skills. And so finally, what I would want to ask um, s- the speakers, our fellows, is that how did mentorship contribute to you having a successful application? And since you have become fellows, how has mentorship also strengthened your outputs and your deliverables? This is our final question as we round up this conversation and the masterclass. Thank you.
All right, ma. Thank you so much, ma. Um, Mentorship is a very huge thing that every applicant or every individual should embrace. And then, even during the application, it is very good for you to ask people around that they are vast, and then they can really help you to review all your essays, even your CV. Is this CV worth submitting? And then your essays, what can you still put in to ensure that these applications stand out? And then it is very good speaking with experienced professionals that can really help you to refine and then to reposition you for at times that skill that you think you have that you feel like it is small. Mentorship can help you amplify it in a way that it won't look as if you are lying, and at the same time it won't look as if you are underrating yourself. So speaking with professionals can really help one to improve personal statement and avoid common errors. So that is one. And then during the mentorship, during this fellowship program, what mentorship has really helped me with is that it's really helped me to want for me to be accountable. That is one, because I know that my mentor will always ask me, what have I done? So that's pushed me out to really engage with whatsoever activities that I'm supposed to engage with, and then put them down, document them, because I know that I have to submit a report to my mentor. So mentorship really helps me during this process to improve some skills, some soft skills that I have in communication, uh, accountability. So those are the things that mentorship has really helped. Then it helped also in exposing me more to network with people. Mentorship can really do that, because I can remember when I got to know our doctor. She just I think it's through LinkedIn, and I message her, and since then she has been helping when I want to conduct I conduct when I want to conduct my first capstone project, which is based on hepatitis. There are some insights that she really brings to that project that really helps that project to be successful, by telling me to, okay, I have to do a baseline assessment. Okay, what are the really prevailing rates of this particular infection within that community, within the state, and even in Nigeria. And getting this baseline assessment really helps me to really do what it's needful while I'm trying to execute that project, because I have to know, okay, if I have baseline of, okay, in, for example, in Osun State we have 3.4 prevalence rate of hepatitis. Okay, how, what prevalence do we have currently, especially in my local government, and what am I going to do to reduce that prevalence or to stop the spreading of that particular disease. So those are the things mentorship can really shape on you to, because you can't think it all for yourself, everything you have to be under guidance and people that will also contribute. In fact, and then mentorship is not all about going to one big person that, okay, as very low as your community, what's it called, and health secretary can be, you, that person can be can mentor you through some process even during the fellowship. So to me, mentorship is very, very key, because it will help you a lot. It will guide you. You won't just do things haphazardly. You have an order to do things, and that can only be done through mentorship process. Thank you, ma.
Thank you so much, Mr. Daniel, for talking about mentorship and how it has helped you to achieve more within a very short time. And that we're very big on mentorship in the public health professional help. And we hope that this masterclass will also serve for this National Health Fellows program. So, to Madam Esther, I would like to know how mentorship has helped you in the application process and since you've become a fellow. Thank you. Hello, Miss Esther.
Sorry, I didn't know I was muted. I was, yeah. So not to repeat what fellow Daniel has said again, just to like share my personal
Hello,
experience
Esther. Did you hear
concerning.
me?
Yes, yes. Can you hear me? Can you hear me now?
How has mentorship assisted you in this process?
Okay, please. Can you hear me?
Yes, we can hear you. We can hear you.
Okay, yeah. So in the process of application, how mentorship has assisted me. Firstly, I would say that even being a public health practitioner that I am, yeah, that I am, I still had issues in first filling the application. I needed someone that could put me through, and then I asked questions. Like I asked from one of my senior then in school. He was like a mentor. Yeah, he's my mentor. Yeah, he was a mentor to me then in school. So I asked him that, this is the particular question they asked me. Oh, how am I going to go about it? It's not as if I don't have the answer, but I needed someone to put me through that. Oh, this is how. Why not to do it like this? Why not write it like this? You have experience on the field. Because my thought was, oh, I did not have any experience. What am I going to write? It's just school and all of that. And for it, we used to do field work back then in school. So he said those are the things you can actually put when you did your CWES. It's also an experience. It's a community work and all of that. So those are the things I'm going to put, because I was like, how am I going to go about it? What did I do? Have I even given to my community? So it made me realize that the fact that you went for field work, you visited communities when you were in school, as small as it is, put all those things together. You volunteer at this particular place. Put, even if you worked in, because I worked in the library, put it together. That's you giving to the community. So that's them seeing that, oh, so it made me really see mentorship as something very big. You can ask questions. It's really going to put you through. And so I give kudos to the person that actually helped me with the application. It made me know the essence of mentorship, because I wouldn't have thought about that myself. So, but getting to the national health program, I would say that the benefit that comes with it is that you'll be attached to a mentor. majorly a public health professional that is going to guide you through the process. And my mentor, Mrs. Dr. Mrs. Kende, she has really been helping when I have issues. She asked me, "Do you have any problem? How can you provide solutions to it? If you have any problem, let me know." So, what happened on the field today? I'll report to her. Why not? Let's do it like this. And also, our state coordinator, Dr. Ariadiago, has also been a very good mentor to me. I mean, when I wanted to do my capstone project, I reached out to the medical officer of health at the local government. Um, I reached out to my mentor, compared our information together. I also went to meet the state coordinator to tell him that this is what I want to do. So, how do you think I can go about it? So, doctor made me realize that you don't just say, "Oh, you want to go to the community and say they are having low utilization." You have to check the DHIS. You have to go to the local government. You have to ask them for data because you are working based on data. And that actually helped me to it informed my decision on carrying out my capstone project. Mentorship, I would say, is a huge thing to actually key into when you're in the fellowship and even outside the fellowship. Yeah, thank you.
Wow, wow, wow. It's been an amazing conversation with our fellows, Mr. Daniel Oluwatosin Afolabi and Miss Esther Oluwadunsi Aderibigbe. Thank you so much for the information you have shared. I know that this masterclass is going to be very helpful for a lot of people who are interested in applying for the fellowship, and I believe that your tips and a lot of the things that you've highlighted will contribute to someone's success in the application. And this is also to thank the Federal Ministry of Health and the Swap Coordination Office for a very, very laudable and commendable program that is improving the health sector, that's from the community level, empowering young Nigerians to give back to their communities. To our audience, for those who have stayed with us on the live, we thank you very much. And for those who are going to watch the replay, we hope that you'll be able to get a lot of insights and information from this recording. And for those who still have any more comments or questions, you can put it in the comment section and it will be addressed by our fellows and myself. And this is Dr. Olukemi Olugbade, the curator of the Public Health Professionals and Students Hub, saying thank you very much for staying with us in this career masterclass. And we hope to see you again in another masterclass that will be helping early and mid career public health professionals advance their careers through global opportunities. So, till we see next time, goodbye, everyone. Thank you for your attention and participation. All right. Thank you, speakers. Bye.
Bye.
All right. Thank you.